Gary, do we want to wait a couple of minutes while people are still coming on?
We can give it about 30 more seconds. There's still some people kind of flowing in, and then
Okay.
we'll get started.
Okay, I tell you what, why don't you just let me know when we're ready, and we'll get started.
Sounds good. Welcome, everybody.
Oh,
And you can go ahead. It seems like we're at a lull.
okay, great. Looks like we have a good turnout this morning. Well, I'm Dan Kessler. I'm the Interim Executive Director of April. It's great to be with everybody today. And I know you're all very busy, and so we're really grateful that you're able to be with us as well. So what we're going to be doing today, this is part of the work of the Advocacy Committee. And what we're going to be doing is to work towards coming up with, and many of you, by the way, we had sent out a survey that many of you, I think, responded to regarding April's priorities. What you'd like to see is April's advocacy priorities. And so what we're going to do today is to go through the process where it's called a discernment process. And so, and this process is a way in which we can come up with a manageable number of advocacy priorities that we will then be submitting to the board for approval or adoption. And so we have we had some really good responses, a lot of variation, a lot of really great ideas. And so we have an individual that's done a lot of work with the Pennsylvania Centers for Independent Living. I want to thank Misty Dion for referring to us, Rick Pierce. Rick he's with Penn State University, and has done a lot of work around assisting nonprofit organizations, as I said, including the CILs in Pennsylvania, arrive at priorities. And so we're just really thrilled that we've been able to bring Rick in to help us with this process. And so what I'd like to do at this point is just to turn it over to Rick, and so we can get started. Rick?
Excellent. Good morning, everybody. It's great to see some of you. In a minute, I won't be able to see any of you, so you can choose whether you want to stay live or whether you want to just stay in the background here. That will be fine. As Dan said, I am currently an associate professor at Penn State. As of July 1st, I will be retired from Penn State. So the work we're going to do today is some work that I did with my business partner, Jim Rao, organization called Rising Sun Consultants. And we call it a discernment process. Other people use different names. But the basic idea of discernment process is that it is a brainstorming process in which everybody gets a voice. Everybody gets to be heard. Everybody's ideas get on the board. You know, we all have been in brainstorming processes where somebody dominates the room. Somebody else says, I'm not even going to bother. They're going to get their ideas up there. And then you get them on flip charts and, you know, they're all over the place and you can't make any sense of it. It's new for us to be using electronics to do this. Most of the time we do it face to face, but we'll be able to do it. Misty has done it a couple of times and others have done it. So I feel very comfortable that we're going to be able to do this very well. There are a couple of ground rules that I think it's really important that I go over in this process. But before I go, let me just explain that Abby, wherever Abby went to, Abby's still here. Abby is going to be our counter. So when we get to the point where we're actually going to be voting on things, Abby's going to be counting so that I can focus both on you and on the spreadsheet. And Sierra is going to be our chat person. And what I mean by that is it's very, very difficult for me to follow the chat while doing this process, also because of my vision issues. it makes it difficult. So if it's critical that whatever is said on chat that I need to know right away, Sierra will interrupt us, and so that your voice can be heard. Now, having said that about your voice being heard, here's one of the things that makes this process, I believe, work so well, and why I believe Misty recommended me to April to do this. I am going to be very supportive of letting you share your thoughts and ideas unless they become redundant or you begin to filibuster. Okay, we have 4 hours to reduce what currently is a list of 159 ideas to no more than 5 or 6 final priorities. I feel very comfortable that we can do that if you all play nice. And my guess is you will, because you want this to work. So I'm going to be using a process where instead of asking you for support or asking you if you agree with things, I'm very often going to ask the question, is there anybody who cannot live with and support this decision? So not just live with, guys, but support. The goal here is there will be no parking lot meeting. No meeting after the meeting where somebody says, well, I really didn't like that. I wasn't in favor of that. All it takes is for you to raise your hand or make a signal, whatever we're going to use, for that you don't support us moving forward, and we won't move forward. Okay, so I will never allow this group to overwhelm you, overrun you, or cut you off. But again, if you filibuster, if you talk too long like I'm beginning to, then I'm going to cut you off by saying, for example, does everybody understand what Karen is saying? Okay, so I'm going to ask the question in that way. And as soon as everybody suggests they do, then we don't need to keep going over it and over it and over it. But it will all make sense as we go. I ask you to trust the process. I ask you to trust me. I've done hundreds of these, guys, and I've never seen a group where it didn't work, nor have I ever had a group where at the end, people didn't feel that their voice was heard. So before we begin, are there any questions, any concerns, any challenges? Okay, now Sierra, I was just thinking that I'm lying. Abby, I was just thinking that this may be, if people are looking at, I know for me, if I'm going to be looking at the spreadsheet, again, I won't see everybody. So you guys are going to have to be my eyes to tell me to either come back on screen here because somebody wants to share something. I'll be able to hear them, but I won't be able to see them unless I come back on screen. Now, when we ask people to quote unquote vote, we're asking you either to physically raise your hand or to electronically raise your hand. And that's what Abby is going to count. If you can't, if you have trouble with either raising your hand physically, or for some reason you can't get the electronics to work, then go into chat and tell Abby to make sure that she adds you. But we're a long way away from voting. We'll talk about that more in a little while. You've all been given in chat a link to the spreadsheet that we're going to be using. So I'm opening mine now. Actually, I'm going to share mine. Okay. You want to go, when you get onto the spreadsheet, folks, you want to go down to where it says original. You want to start on the original spreadsheet. What I did is I took this original spreadsheet, and if you move to the next one that says same, you'll see that some of them are highlighted either in yellow or in brown or orange. Our goal here is to identify all the ones that are exactly, and I mean exactly word for word the same, not worrying about caps, whether it's small letter or capital letter. But if you see the first two that are highlighted, both say accessible housing. We don't need two that say accessible housing. So the question I have for you, is there anybody here who cannot live with and support combining the two accessible housing? And Abby, you let me know if anybody has signaled they can't support it. Okay, thank you. If you look down at number 21 and 22, that says affordable housing. Now, the one above it says affordable, accessible housing expansion. That's not the same. Similar, and we'll come back to similars in a little bit, but right now we're looking for exactly the same. Is there anybody who cannot live with and support combining the two affordable housings? Thank you. If you go all the way down to number 58, you'll see two guardianships. Same question. Is there anybody who cannot live with and support eliminating one of the guardianships? Thank you. 62 and 63 say health. Anybody cannot live with and support combining the two healths?
Reminder, if you cannot live with combining those things, please make sure to indicate that by physically raising your hand, using the raise hand button in Zoom, or indicating in the chat.
Yeah, it's not surprising that people are not responding. This is typical when we're in the same category. If you look from 72 to 77, 72 to 77 all say housing. Is there anybody who cannot live with and support us combining all the ones that just say housing? Okay, great, thank you. The next two, 78 and 79, say housing, low income / affordable. Is there anybody who cannot live with and support us combining those two? Thank you. And 80, 81, housing, subsidized housing, section 8, waiting lists are too long. Is there anybody who cannot live with and support us combining those? And by the way, I promise you, we're not going to lose the fact that housing had 6. We'll come back to that in a bit here.
What about 82?
That's not the same as anything that we've seen so far. Is it exactly the same? I know it's similar, but we'll come back to similars in a little while. I don't think that we've had that one yet. I'm pretty sure we have not. No. Okay. Keep going all the way down. The next group is 119, 120. Both say rural transportation. Is there anybody you cannot live with and support us combining those? And by the way, again, the reason why I'm taking the time to do this, I could have just done all this myself, obviously. But you need to see, and you need to be able to report back to the people you represent, that everybody's voice was counted. Okay, they're both there. They're both there. But now we're combining them. This next one's going to be a big one. Okay, 36 through 46 all say transportation. Is there anybody who cannot live with and support us combining those?
Rick, I just wanted to point out in the chat, Jamie Whitfield says that lines 23 and 25 differ only by the use of a comma versus a slash.
Okay, we'll come back to similars in just a minute. Right now, I'm trying to identify exactly the sames. Okay. I promise you, if you trust the process, we will get there. The next two are 50 and 51. Is there anybody who can not live with and support combining the two, transportation in rural areas? Now, I violated my own rule here with 156 transportation because it does have the 3 dots after it. That should not have been included, but it is. Okay, so if you all go to the next tab that says similar, you'll notice we're at 159. If you go to the tab that says similar, you'll see we're at 135. I have taken out all the ones that were highlighted in brown. Now, what similar means, let's go to the top 2 here. You're going to have to tell me, and again, Sierra and Abby, this is where I'm going to need your help. You see where it says 545 and then 5th core services. Are those similar enough that you would be comfortable combining them? Is there anybody who could not live with and support combining 545 and 5th core services?
And there are 2 hands up.
I'm sorry?
There are 2 hands up.
Okay, so then we'll just move on. We'll just move on. We got to trust the process. Okay, now there was another one. Let's go see what that one looks like. So all the way down the bottom, or close to the bottom. Number 171, the NCIL 5 for 5 campaign. Is that the same or similar enough to 5 for 5? Would anybody not be able to live with and support combining 5 for 5 under the NCIL 5 for 5 campaign?
Greg, this is Misty. Can I make a quick suggestion?
Absolutely, Misty.
Can we rephrase that? Is there anyone who cannot live with and support the nickel 5 for 5 campaign falling under 5 for 5 campaign? Because it's
That's fine. I don't care which one.
right.
That's up to, I mean, that's what you guys have to tell me.
Yep, I'm just clarifying that the campaign is a joint campaign, so it might be easier if we word it that way.
Okay. So is there anybody who could not live with and support putting the nickel 5 for 5 campaign under 5 for 5?
There's 1 hand up.
Okay, then we move on. Okay, so anybody else see any like that? What was the one about the comma?
It was lines 23 and 25.
Okay,
It's actually, it's 21 and 23. Now that I'm looking on this sheet, it's 21 and 23.
Oh, okay.
Affordable, comma, accessible housing versus affordable / accessible housing.
Okay, well, let me do these one at a time then. Can affordable, comma, accessible housing go under affordable housing? Or could affordable housing go under affordable / accessible housing, which would make more sense, guys?
If anybody has a thought about this, please feel free to speak out if you feel it should go one way or the other.
Actually, if you look up to number 10, we have accessible housing there. Could anybody not live with and support moving accessible housing and affordable housing under affordable, accessible housing?
Well,
Um,
there is
Go
a
ahead,
phrase,
Tom.
affordable, accessible, integrated housing, and I think that would cover it, all of it.
Okay, and where is that one?
I think we just.
Number 14.
14.
Of accessible, affordable, integrated housing dash supporting
Yeah.
full participation community.
Okay, so let me do this one at a time, okay, or else I'm going to get very, very confused very quickly.
And sorry, you do have a comment that says affordable and accessible are two different things.
Absolutely. And so if people are not comfortable with that, then are they not comfortable with, is there anybody who cannot live with and support moving accessible housing under accessible, affordable, integrated housing, supporting full participation in community? Do we have any hands?
There is a hand.
Okay.
This
Is there
is Travis.
anybody that's
sorry.
okay, guys? No, that we don't need to discuss it. The process, I promise you, the process will work out. Can anybody not live with and support moving affordable housing under accessible, affordable, on and on, under the one I made blue? Is there anybody who would not live with and support moving 20, combining that with 14? Okay, hearing no hands. I'm taking that one out. Now, affordable, accessible housing.
Rick, we had somebody raise their hand.
Okie dokie.
I'm gonna, just a suggestion, we had a couple of people, I don't know if they all understand kind of what we're doing. So I don't know, it sounds like a couple of people were trying to ask a question.
Okay, so let me try to re-explain. Let me try to re-explain. Our goal is to take the 159 original priorities and reduce it down to 5 or 6 so that they are manageable. You cannot do 159 priorities in 1 year, let alone, in 3 years, let alone 2 or 1 year. So we have to reduce the number. We have to combine, somehow limit the number of priorities. The first way we did it was we took all the ones that were exactly the same, 100% duplicate, and we combined them. So we went from 159 to 135. What I'm trying to do now is to combine any which may be similar. They may be similar enough to combine. Like, for example,
You understand what he's doing?
Yeah.
So
for
then,
example, look at number 21 and look at number 24. No, 23, I'm sorry. 21 and 23 are not identical. One has a comma, one has a slash. But for all intent and purposes, we should be able to combine those. So I'm asking, let's go to that one. Is there anybody who cannot live with and support?
Can I ask a question, please?
Absolutely, please.
This is Don. So when we look at these and people are saying like these are not, like, affordable and accessible are not the same, but we are looking at priorities for advocacy. So would you not want to have those as a priority, even if they are not the same. Because we are looking at priorities. So even if
Yeah.
they're not the same, wouldn't you want to then have the most like accessible, affordable, integrated housing? Even if they're not the same, wouldn't you go towards what is the most?
Okay, is there anybody who does not understand what Don is saying?
Rick, if I can add from the chat, I think that what Travis is saying is pointing to what Don is saying, that if you combine accessible and affordable housing into one category, doesn't mean that each one may need to be addressed separately. So you're gonna have to address affordable housing and address accessible housing separately.
Okay, and that's great, guys. That's great. So let's move on from those, but there already are some people who, when they sent it in, already combined it.
Right.
Right. So later on, when we vote for our top priorities, you probably won't vote for that one because you don't want them combined. That being the case, we probably should leave both on the board. And so that means we have affordable and we have accessible. Okay, so let's move on, guys. See, the whole thing is we could waste hours debating this when the process, I promise you, the process will take care of it and you will be heard. I promise you. So let's keep moving on. Are there other areas? Like, for example, I know there are several more transportation. And again, this is your area, not mine, is access to caregiving services, number 4, and access to HCBS similar, or are they totally different things? Misty?
Can you repeat that question? You didn't ask it as I thought you were gonna.
No, I'm just going to find out. Is
Yeah.
number 4 and number 5 in any way similar, or are they totally different?
They're totally different. HCBS has multiple services, caregiving B1.
Okay, great. So I just bring in my ignorance in.
And somebody in the chat says no.
Okay, great. Thank you. Okay, how about accessible transportation? Do we need to keep that separate from that overall transportation category?
Yeah.
Okay. What about accessible transportation in rural areas? Is that different enough, or can we combine accessible transportation and accessible transportation in rural areas?
And Herschel says combine.
Okay, so is there anybody who cannot live with and support combining numbers 12 and 13? Thank you. Does anybody have a recommendation or a preference whether 12 should be the one we keep or 13 be the one we keep?
Really quick, I'm sorry. Misty, you have your thumbs up. Does that mean you don't want to do that or you do?
Sorry for the confusion. I was happy to offer that. And would suggest that we keep access to transportation in general.
Okay, so you're recommending we put it under transportation in general, so get rid of number 13. And then we'll move accessible down in a minute. But of these two, 12 or 13, do you have a preference for either one? And it sounds like you have a preference for accessible.
Jamie in the chat says number 12.
Okay, is there anybody who cannot live with and support us keeping number 12 and eliminating number 13?
Ari has her hand up.
Okay. Is there anybody who could
I
not?
say I do for that one. Not that I don't agree, but I say I do for that one. For
Oh,
number 12.
number 12, you support it.
Yeah, I support that one.
Okay. Thank you. Let's see if we can find others that are similar. How about additional funding for CILs, additional funding for IL? Are those similar or are they totally different?
Jamie in the chat said different.
Okay, then we move on. Affordable accessible housing, we've already talked about that. Affordable accessible housing for low income, affordable, well, okay, here's an affordable accessible housing. And we have affordable accessible housing expansion. Are those basically the same or are they totally different?
I see same in the chat.
What does Abby say?
Oh.
Same, and then I believe intent was same.
Okay, then can anybody not live with and support us combining 19 and 21? Thank you. Does anybody have a preference for either 19 or 21?
Jamie in the chat says 19.
Okay, is there anybody that cannot live with and support keeping the one that says expansion and eliminating the one that does not? Thank you. And here's another. Affordable, accessible housing. Anybody not live with and support us combining that one also? Thank you. What about civil rights enforcement and civil rights for all? Similar, totally different.
I hear somebody said different.
Okay. Is community development, community inclusion, social isolation similar or different?
Different.
Yeah, that's what I would have thought too. I just focused in on the word community.
2 comments for different.
Okay, good. Thank you. I assume that disability and disability awareness training for schools is not meant to be the same.
I would say so.
Okay. And that education and education for teachers in general about disability services are different.
Different.
Okay. Again, if you see ones that I'm missing, guys, stop me. Institutional bias, end institutional bias, ending the institutional bias.
Same.
Okay, anybody not live with and support us combining them?
I got 2 for same.
No
Anybody-
hands.
No hands. Anybody have a preference for either 46 or 47?
No comments. Oh, 47 from Tyler.
Okay, anybody not live with and support 47 is the one we keep?
It's
Thank
the
you.
same. We can keep 47.
Okay. Equal employment, oh, that's housing, I'm sorry. My mind's starting to. Okay, here we have 5 for 5 campaign. Can we bring that up and combine it with? Oh, no, because we already said those two were different, so I would imagine. Well, can 5 for 5 campaign go with just 5 for 5?
Yes. This was same.
Any preference, whether it be 5 for 5 campaign or just 5 for 5?
Keep 52. Is what the comment.
Okay, anybody not live with and support keeping 52 and eliminating 2? Thank you. Okay, 52 that was. Okay, HCBS direct support and service employee wages, those different?
Different, I think. Somebody
Okay,
Yeah.
okay, let's look at health and health care. Similar or different?
Different,
Okay,
different in the comments too.
okay, what about health education?
different,
Okay, health equity,
different,
health care and health care.
same,
Anybody care how we spell it? One word or two?
No.
Thank you.
There was also a comment. It's I don't know what number it is, Misty, if you know the number. The line that says nickel 5 for 5 campaign can be combined with 5 for 5 campaign.
Yeah, we just did that. We just did that.
There's
another,
There was another one.
Oh, there was another one.
Right.
Okay.
scroll down,
Okay, we'll get to it then when we get there, okay?
Yep.
So I don't lose my place here. Okay, home and community-based services and HCBS.
same,
Better to spell it out or just leave it as an acronym?
spell it out.
Spell it out.
Spell it out is what comment
Anybody who
said.
cannot live with and support us using the spelling it out? Thank you. Okay, we're back to housing stuff. Yeah, these again, we're going to put us in that same place as we had. Housing, affordable and accessible. We already combined several of those up above. Can we also combine this one? Anybody not live with and support that? Thank you. Is increased information on transportation the same as our general transportation category? Anybody want to keep those separate? Thank you. Didn't we already have an increased CIL funding somewhere?
We did.
Anybody remember where?
There's additional funding for IL or additional funding for CILs.
Where's
17,
that?
18.
17, 18. Okay, since we have additional funding for CILs and increased CIL funding, anybody have a preference for one of those over the other?
Abby, you see in the chat, or Sierra in the chat.
There's one that says additional funding.
It's also, Jamie put, CIL funding increase is the 5 for 5 campaign. Can all of us increase CIL funding lines be combined with, so can all of us live with and support CIL funding lines being combined with the 5 for 5 campaign? That would be.
Can anybody not live with and support? Now, and which way would you rather do it? Get rid of 5 for 5 or get rid of increase or additional CIL funding? Or do you just want to wait and see how it works out in the process?
Pat is saying keep 5 for 5.
Keep 5.
Anybody who cannot live with and support my taking number 17 off the board. Thank you.
Oh, we
Okay.
had one hand up.
Okay, let's just move on then. What number was I on? Anybody remember? It was an I, so increase funding. There we go.
Is where you were.
Yep.
And so we still didn't figure out if we wanted to increase SIL funding to go to the increased SIL funding or additional funding. For
Yeah,
SIL.
you know what? Let's just leave it where it is for right now. Again, the process will work itself out.
Somebody commented that 52 needs to be removed.
52 needs to be on what?
It needs to be removed. 5 for 5 campaign.
No, I thought we had we had one objection to that.
Yeah, that was, I think we removed number 2, Misty, and we kept 52 instead.
Right, that's right. Okay, let's keep going. Legislative advocacy, legislative change to prevent landlords. Now that's very specific. Making good decisions, Medicare, medical insurance, Medicare. That was Medicaid up there. Just stop me if you think any of these can be combined.
Number 94 says more funding for CILs.
Okay. Anybody mind me taking this one off because we already have 2 of them on the board? Anybody not live with and support my doing that? Thank you. Okay, what about the 101 and 102?
Can you read out what it says?
Maybe. REAADI and DRMA / inclusive emergency management. And then 102 says REAADI and DRMA.
There's a comment that says keep that.
I'm sorry?
There's a comment that says keep that. And then Jamie said that it's the same.
Okay, but we have one person saying keep it. Let's go on. Like I said, as soon as we have one person, we go on at this point in the process. We trust the process will work itself out. There's another nickel 5 for 5 can. All right, we said we weren't. We're just going to leave that right now. We'll see where it comes out in just a minute.
There's a comment that says 101 is the preference. They are the same.
Okay, but we already had one person say no, so.
Yeah, and 117 is the same as 52.
Rick, I think that the person who said keep that meant that they think we should support that. They didn't, I don't think they meant that we don't combine those 2 line items.
Okay, I'll come back to that in just a second. What was this about 117?
117 is the same as 52.
$52 5 for 5 campaign versus 117, which is nickel 5 for 5 campaign. Which one would you prefer?
We could keep 117 and remove 52.
Okay, so anybody who cannot live with and support my removing 52.
There are 4 people who say keep 52.
Okay,
And
let's just move on, guys. Let's just move on. We're not going to worry about it.
Can I just adjust one quick thing? I think my point was confusing maybe earlier, but it's a joint campaign between Nicole and April. So I think if you just ask it as, can everyone?
Okay. Misty, can I cut you off for a second?
Sure.
And I'll come back to you in just 1 second, okay? Thank you. Okay, there was one higher up that said colored women, and number 135 says women. Can those be combined, or should they be kept separate?
separate, is the comment.
Okay, great. Now, before, let me just go, give me 2 seconds here, guys. It's probably gonna take me a little bit more than that. Let me get rid of all these ones that, come on, computer. Don't play with me. Oh God, this is gonna take a while, guys. Just hang on.
There was a comment that says, should it be women of color instead of colored women? And there was several people or a person that liked it.
Okay, but just hold on. I've got it. I can only do one thing at a time. Is that what I want? Ah. There we go. Okay. So I'm going to make a recommendation that if anybody needs to take a break, you do it now, because I'm going to need a few minutes here.
How long do you want the break?
5 minutes?
Okay. So we'll come back at 12:55 and make it 8 minutes. If you're on East Coast time.
That's fine.
Yep. Rick, do you need anything?
Nope. I think we start back in 1 minute, right? Yep.
Mhm.
Okay, if everybody could come back. When we left off last, there was a comment asking if we could change colored women to women of color. Is there anybody who cannot live with and support that change? Thank you.
Rick, this is Abby. Can we, if possible, give folks one more reminder about how we're going through this process, how it's working?
Yep, absolutely, because we're moving on to a new section. So if everybody would now open up the letters tab.
Really quick, Rick, there was a comment that says when we return lines 120 and 123, which is now 110 and 113.
Okay, we'll get there in just a minute then, Sierra. Remind me, okay? Can everybody please go to letters? Okay, say that again, Sierra.
Lines 110 and 113. I don't know if that's on the letters one or not.
Yep, okay, so line 110 reads transition and diversion. And line 13 means transition from institutions to community and diversion from institutions. Is there anybody who cannot live with and support combining those? Thank you. Do we prefer the shortened one or the full one? Anybody have a preference?
I don't see any comments. Oh,
Uh,
the full one. Yeah.
Okay. Hold on, I gotta move this again. Okay. So now we're, like I said, we're on page letters. We're in the letters spreadsheet. What we're going to do now is we're going to begin the voting process in just a minute. But before we do, I want to do two things. I want to give you the opportunity to, well, let's do one at a time because I will just keep it easier. Is there any of these items that anybody like Misty, you've been advocating for combining the 5 for 5 with which one?
With the 5 for 5 campaign.
Okay, I thought that one we already did. I thought we saved the 5 for 5 campaign, but you said something about nickel.
Yeah, removing the one that says nickel 5 for 5 campaign and keeping the one that says 5 for 5.
Okay, so let's find all of these 5 for 5 things. If anybody sees them, one of them, yell it out.
There was a comment, all 5 for 5 and increased funding.
Okay, so we have TT or number 47, right? TT or number 47. And what are some of the other ones? And increased funding? No, not increase wages.
So 107 is what somebody commented.
Well, how about, okay, 107
Mm-hmm.
is the next one. Okay, I'm gonna just change the color of that for a second. Okay, and then somebody else said something about the increased funding. Well, let's just take those two first. Okay, so nickel 5 for 5 campaign and the regular 5 for 5 campaign. Is there anybody who cannot live with and support combining those two?
No hands up.
Misty, which one would you suggest we keep?
5 for 5 campaign.
So anybody who cannot live with just keeping the 5 for 5 campaign and taking the nickel campaign off the board, since Misty is expressing that it's a combined effort.
No hands.
Thank you. Okay, now what about this increased funding?
So there is a comment that says line 15 and 16. It looks like increased self-funding.
Right? Additional funding for CILs. And additional funding for IL. Now, we were already told people saw those as different.
Right.
Now, here's what I'm asking. Can we combine them in the sense of and both? Not either or, but and both. So can we say which 5 for 5 did we say? Okay, number 47. Can that one say 5 for 5 campaign / increase funding for CILs?
15 and 66 are the same, not 15 and 16.
15 and 66 are the same.
Okay, let's do those first then. 15. And 66. And 66 are the same. Can I get rid of this one here on the bottom? Anybody not live with and support my getting rid of 66? Thank you. Can we do a both end? Can we make 5 for 5 campaign / increase funding for CILs? Is there anybody that cannot live with and support that?
Got a yes, they can support it.
Okay,
Support.
yep, got it.
We also had a comment asking if we could change the spelled out word 5 to the numeral 5, since the numeral is what is used on the actual campaign.
Sure. That's easy. Okay, now I need to go back up to additional funding and eliminate that one. Okay, does anybody have any others that they want to do a both end? We can always come back and do it again later, guys, so.
I don't see any comments.
Okay, so
Oh,
hearing
wait,
nothing.
sorry, 21 and 22.
Okay, that's not 21, child rights enforcement and civil rights enforcement, civil rights for all. Somebody objected to that before. Can you explain why?
Yeah, this is Tyler. I think those are different things. I think enforcement of civil rights is very different than imparting civil rights to folks.
Okay. Does anybody not understand what Tyler's trying to say? Okay, thank you, Tyler. We'll leave them where they are. So before we vote for the first round, would anybody like to advocate for or against any particular priority? We're
Misty
about to
had-
vote for them. Does
Misty has her
anybody-
hands up.
What?
Misty had, oh, well,
Yeah.
maybe.
Question.
Yes, Misty.
And I think it was Travis who just, was it Travis or Tyler who just responded? But my question, I thought, Rick, you were asking, not that we would merge the two, but what could everyone live with and support adding them? So it was
Oh.
this and that.
You're right. So Tyler, would you be comfortable? Can you live with and support combining civil rights for all and enforcement, or civil rights enforcement and civil rights for all?
This is Tyler, and I'm hesitant to, and I'm not exactly sure why. but
Okay,
There's
so
something
let's
that
just,
tells me they're different.
okay, Tyler, let's just leave it alone. We'll come back to, like I said, the process will work it out. So does anybody, we're about to vote for our first round. Does anybody want to advocate for any of these priorities in particular?
There's a comment for 38 and 89/90.
What does that mean? To
I guess
combine,
line 38 and 89 or 90 to
okay,
combine.
so 38 says emergency planning. So this is a and both? 38,
Combine, as Jamie's saying, combine those three.
38, what?
And 39.
No, I went too far.
No,
39,
sorry, 38, 38, 89 and 90.
89 and 90. Well, we already had people say they did not agree with combining 88 and 90. So would someone like to speak to that, please?
I think that might have happened, Rick, when we were still a little confused on the process. As I recall, I think the person who raised their hand was saying that they agreed with the support of that, not that they didn't want to combine those line
Okay.
items.
Okay, so is there anybody who cannot live with and support combining 89 and 90?
No hands.
Okay, I'm gonna take off the shorter one because that's kind of been our pattern. And then we can also that way, if everybody's okay with it, we can also combine with 89. What was that first one, like 34?
38.
38. 38, emergency planning. Anybody not be able to live with and support combining emergency planning with REAADI and DRMA, inclusive emergency management?
See no comments.
What was that, Sierra?
No, there are no comments.
Okay, then I'm gonna go back up here and get rid of emergency planning. Okay, anybody else want to advocate or do an and or both? Okay, I know this takes a long time, guys, but in the end, I think you're going to be very happy with the results. So let's go ahead and do our first round of voting. This will take a while also. We have about an hour left today, and then we have 2 hours on Thursday. So we're in pretty good shape. So we have a total of somewhere around here. We have a total of 119. We're going to use a process called an N over 3. What the N over 3 does is it gives everybody, we're going to take the 119, we're going to divide it by 3, which gives us, wow, it's going to take, we're going to be here for a while. It's going to give everybody 39 votes. So take a few minutes, go through the list here. How did we get all the way down? Well, I went even past what I thought we would. Take a few minutes, go through the list, and identify the 39 priorities that you want to vote for. Now, you may only vote once for any one priority. You don't have to use all of your votes, but you cannot use more than 39, and you can only vote once per priority.
Reminder, the link to this document is in the chat. If you are utilizing a screen reader or want to view it at your own size, you can do that. The document is view only, so you won't be able to edit the document. You're going to need to make note of which ones you want to support in your own document, on a piece of paper, something similar. We have a hand up from Tyler.
Yeah, this is Tyler. Is the document you shared current with the changes that have been made?
Yes,
Okay, thank you.
it
Make
is
sure
view
that-
only.
I was gonna say,
Right.
make sure you're looking at the right tab, which
You should be on the letters tab.
there's.
So at this point, let's give everybody 3 minutes. We'll come back to everybody at 1:15 and see if people still need more time. And it's okay if you need more time. Don't hesitate to say you need more time. This is a big document.
Hey, Rick, this is Dan.
Yes, Dan.
I don't want to get ahead of ourselves here, but could you maybe tell us after everybody votes, okay, and say on their top 1 to 39, however many votes they choose to use. The next step then will be going line by line. Is that what?
Line by line.
Okay, thank you.
And that's why I'll need Abby's help to count.
Rick, this is Missy. I have one more question similar to the process question.
Missy, you're hard to hear.
Can you hear me any better now?
Yeah.
How about now?
Yep.
This is the next process question. After we make our votes and go through line by line, the lines that do not get any vote, will they be dumped or will there be?
I'll talk about that in just 1 minute, okay?
I just thought that would help people make their vote.
Okay, we can talk about it now then. I'm going to ask you all to agree that if nobody votes for a particular item, then that's agreement, that's tacit agreement that we're going to take that item off the list. Okay, so if nobody votes for a particular item, let's say nobody votes for access to caregiving services, then that item will be taken off the list and for the rest of the voting. So with these 39 votes, you get a chance to vote for the 39 items that you feel strongly about. 1 vote per item. A 0 means we automatically take it off the table. How many people still need more time? Okay. That's great. Just take the time you need.
Here's a hand up, Maria.
I'm sorry?
There's a hand up. Maria has their hand up. Oh, it
Oh,
went away.
sorry. That was
Oh, go
just
ahead,
for more time. That was just for more time. Sorry, I forgot to take it down.
Oh, more time.
Thanks.
Oh, I'm sorry if that messed anybody up. I keep forgetting that you can see what I'm doing. Sorry again. Anybody still need more time?
I see a nod.
Okay, so let's try. We'll go to 120 and see where we are.
Did you say we could vote up to 39 times?
Yep.
Okay, thanks.
Okay. People still need more time? Thank you. Okay, I'm going to call out both the number and the letter where I can. And you either physically or electronically raise your hand or somehow communicate to Abby that you want to vote for this item. Okay, so how many people voted for line 2, letter A?
I see 3 hands.
3 hands.
That's it?
4.
4 hands.
Yeah, give them a minute. That's what happens.
Hey, Rick, would you also repeat the adequacy priority as it's listed?
Say that again?
If you would repeat the advocacy priority, such as on 2A, that is fifth core services.
Oh, you want me to read it?
Yeah,
Yes.
just read that. as
Okay.
well,
2A, fifth core services. Services.
yeah. Thank you, Rick.
2A, fifth core services. Okay, what do we got, Abby?
5 hands.
5. Okay. 3B, access to caregiving services. You've got to take down your hands from the last one unless you're voting again. Okay, just call it out, Abby, when you think you have it.
I have 6 hands.
Okay. 4C, access to HCBS.
I have 6 hands.
5D, access to internet in rural communities. The cost is high, and since COVID, we have seen how much this lack of access limited many from students to working from, I'm sorry, my eyes, to working from home and social isolation.
Seven hands.
6E, accessibility in public locations.
Nine hands. Oh, hands have gone down. 1 second. I have 8 hands.
There's 1 hand raised physically as well.
Yes, I was counting that
Okay.
one.
Okay. 7F, accessibility options for children with disabilities in preschool.
Two hands.
8G, accessible healthcare.
Four hands.
9H, accessible housing.
Three hands.
10I, accessible housing in rural communities.
Five hands. Just okay.
11J, accessible transportation.
Nine hands.
12K, accessible, affordable, integrated housing, supporting full participation in community.
That is 9 hands. And Rick, if you could add 1 more to the count for G. Somebody missed voting for that and wanted to.
Yep. That happens. 13L, access to work experience options for transitional age students.
Four hands.
14M, ADA training for employers.
Seven hands.
15, additional funding for 15O, additional funding for IL.
Seven hands.
16P, affordable, accessible housing expansion.
Five hands.
$17Q, affordable housing.
No hands.
18R, affordable, accessible housing for low and middle income individuals and families.
Two hands.
19S, better pay for personal assistance.
Eight hands.
20T, broadband access in rural areas.
Six hands.
21U, civil rights enforcement.
Ten hands.
22V, civil rights for all.
Seven hands.
23W, colleges being more fluent in accommodations and providing them.
Nine hands.
24X, women of color.
Four hands.
25Y, communication access option / lack of interpreters.
Six hands.
Sorry. 26Z, community development.
No hands.
27AA.
Oh, one
Community-
hand went up. Sorry, for community development, one hand.
AA, community inclusion / social isolation.
Six hands.
28 BB, consumer directed services.
Seven.
29 CC, COVID effects.
Two. Three.
30 double D, direct care workforce shortage.
Six. 7. Actually, 7.
$31 double E, direct federal funding opportunities for SILCs. Silks, I guess.
Four.
32 double F, disability.
Three. And then Rick, can we add an additional vote onto X? And also onto M as in Mary?
So X goes up to 5. And Mary goes up to 8. 8. $33 double G, disability awareness training for schools.
Eight.
34 double H, direct ACL funding unwanted, most restrictive institutional.
Three.
35 double I, education.
One.
36 double J, education for teachers in general about disability services.
Seven.
37 KK, eliminating reduced minimum wage for workers with disability.
Seven.
38 MM, employment outcomes.
None.
NN, encouraging service providers to provide support for any career a PW disability might want instead of defaulting to minimum wage jobs and saying people can't go to college.
None.
4000, ending the institutional bias.
Nine. 10.
41 PP, environmental illnesses, chemical and EMF/Wi-Fi.
None.
42 QQ, equal employment.
Two. 3,
43 RR equitable housing.
2,
44 SS equity, diversity, inclusion, and accessibility.
8,
45 TT 5 for 5 campaign / increase funding for CILs.
10,
46 UU fund transition services.
5,
47 VV grassroots movement advocacy.
5,
48 WW greater access to faster Social Security disability approval.
5,
49 XX guardianship.
3,
50 YY HCBS direct support and services employee wages.
1,
ZZ health.
1,
52 AAA healthcare.
'None.
53 BBB health education.
1,
54 CCC health equity for underserved or underinsured.
10,
55 DDD help with insurance barriers.
4,
56 EE health education options for students with disabilities.
6, 7,
Well, make up your mind, Amy.
Listen, I'm just reading what the people are showing me.
I know, I've been there and done that. 57 FFF holding insurance companies MMA to their promises of meeting minimum required care. Too many consumers have too many hoops to jump through just to try to get care and transportation they've been promised. Most of the time, parentheses, most of the time that service is why they choose a given plan over another, close parentheses.
None.
58 triple G. Home
Sorry,
and
57 had one vote.
Oh, I'm so sorry. I missed it. My apologies.
58 triple G. Home and community-based services.
Seven.
59 triple H. Housing.
None.
60 triple I. Housing. Low income affordable.
One. Two.
61 triple J. Housing. Subsidized housing. Section 8. Waiting lists are too long.
None. Oh, one.
62 triple K. How to be part of a board.
Two.
63 triple L. Increased wages for providers.
Three.
64 triple N. Increased community disability awareness.
Eight.
Well, I'm sorry.
8.
8. 65 triple O. Increased funding for HCBS self-directed services.
Three.
3. 66 triple P. Increased housing / rental supports for low-income individuals.
Three.
67 triple Q. Intersectionality with the LGBTQ plus community, especially the trans community, when it comes to receiving health care, parentheses, both transitional care and educating specialists about trans patients, close parentheses.
Seven.
68 triple R. Involuntary commitment of people because they are homeless.
Two.
69 triple S. Keep hospitalists from taking over our treatment when we are in the hospital.
None.
70 triple T. Legal assistance program for PWD.
Four.
71 triple U. Legislative advocacy.
Six.
72 triple V, legislative change to prevent landlords from denying HUD vouchers for rent.
Two.
73 triple W, legislative process / testimony training.
Two.
74 triple X, LGBTQIA rights.
Three.
75 triple Y, making good decisions and how to take care of yourself.
None.
Triple Z, 76 MCOs.
Three.
We're getting there, guys. 77 4As, measurable outcome for deep, independent living.
Four.
78 4B, Medicaid expansion.
Five.
79 4C, medical services.
One.
80 4D, medical / insurance access and navigation.
Two.
81 4E, Medicare for all.
Six.
82 4F, more funds for waivers for home health to reduce waiting lists and provide higher wages.
One.
83 4G, overused or unnecessary restrictive guardianship.
Five.
84 4H, poverty.
Two.
85 4I, program management training.
Three.
86 4J, push for updates to 504.
Seven. Eight.
87 4K, raising the wages for IHSS providers.
Two. And just a reminder, our CART and interpreters have a hard stop at 2 p.m. Eastern.
Okay, we'll get as far as we can. 88 4Ls, REAADI and DRMA/inclusive emergency management.
Eight.
89 for ends reauthorization of the Rehab Act.
Five. Also from Sierra in the chat, if you want to be added to a count that you missed, drop it in the chat and we will catch up after the call. Rosalie was not counted for quadruple L.
Okay, okay, we can still go a little bit here. 4090, reliable rural transportation for PWD, both public transit and Medicare, Medicaid-based transit that is included in membership in certain health plans. Most of the times these plans try to rely on subcontracting transportation, and PWD miss appointments when these providers don't show up.
Four.
91 for Ps, removal of recertification for paratransit only certify once.
One.
92 for Q, rural direct care workforce.
Four.
Okay, I'm going to recommend we stop here since we are going to lose the translators and the interpreters in 5 minutes. We're going to have to pick up here on Thursday. Let me just make a couple of comments from what I'm seeing. I've done this many times, guys. A lot of you are voting for things which are not advocacy. Okay, a training program is not advocacy. You know, for example, if I could find things here real quickly, Medicare for all. Yeah, you can absolutely advocate for Medicare for all. You can advocate for poverty, raising wages, but I'm trying to find some of the ones that were clearly just training programs.
85.
What?
85, I think, Rick. Number 85.
85. Program management training. Excellent. That's not an advocacy issue. Is program management training important? Yes, but that's not what this committee does. And again, we have to get down to only 5 priorities, but we'll talk more about this when we begin next week. I still feel pretty confident that we can still get through this with 2 more hours left.
Rick, that's later this week.
That's what I said, wasn't it?
Next week.
Oh, no, it's later this week.
Yeah. Okay.
Yeah. I'll be out in Nebraska. Okay, guys, good work so far. I promise you we will get through this. It does take a while, but we will get through this.
Yes, it's Thursday. So
It's Thursday.
say if Rick, you could stay on along with
Yes, I was going to ask that too.
yeah, is with the April staff and Misty.
Yeah, I'll be right back though.
Okay.
Hey.
Thanks, everybody.
Yeah, thanks so much for being part of this. I know this is a sort of a long process, but I think in the end, we're going to be happy with the results.
And so we'll see everybody again on Thursday, 11 a.m. Eastern time. So see everybody then.
Thank you.
I guess pack a lunch if you have to, huh?
Dan, do we still need the captioner?
Our captioners should be leaving. Yeah. Ours just finished.
Hey, Rick,
He just
there's
left.
I'm seeing this gray block
Yeah.
on the, is that up there intentionally, up there in the Excel spreadsheet? Yeah, that one.
This one that I just moved,
Yeah.
that's you guys.
Oh,
Oh, that's us. That's our
Yeah.
end. Okay.
Oh,
I was
um,
wondering that too.
also Sierra, all my comments are coming in as you and it's tripping me out.
So Rick, just to let you know in the future, so that on our end, when you're sharing the screen, it just shows up with black boxes over the document.
But I made sure that it was far enough that it doesn't cut off any words.
Yeah, so
Okay,
we could see
okay.
everything. That's why I never mentioned it, but
Because I like to at
Okay.
least be able to see some of you.
Yeah.
So here's what's happening, guys, and
and I really quick, I see Lauren, if you would like to stay, you can, or you can go. No pressure to stay. See, you're still on.
So part of what's happening, and it would have gone faster, I think, if we were live and in person. It was the problem of not being able to get